For example, the hernia we fear the most is the ruptured hernia. A doctor fears the most is a ruptured, huge, very large hernia. So like the nerve is underneath, the nerve is trapped below, you can't see the nerve at all. The canal is completely filled with the hernia, so we would make emergency surgery decisions. Nowadays, for patients who would have needed emergency surgery 10 years ago, if there's no loss of strength, non-surgical treatments for ruptured hernias have high success rates. Hernias start with pain, such as back, neck, leg, hip, or arm pain, while lumbar hernias are often focused on. Cervical hernias are also important. Spring is when hernias progress and rupture most, and we are currently in a period of low pain. So, if you have back pain, neck pain, along with leg pain, hip pain, or arm pain, we usually focus on lumbar hernias, but cervical hernias are also important, especially during this season. Look, spring is when hernias progress the most, when they rupture, and we are currently in a period of low pain. Especially during this season, look, spring is when hernias progress the most, when they rupture, and we are currently in a period of low pain. So during these times, we see a lot of hernia ruptures, very severe pain starts. You can't get up from your beds. You try to get up by crawling. You bend over in pain, crying out for help. You get twisted. Look, it can happen just like that. A ruptured hernia can occur suddenly. So am I making myself clear? It will bend you over, twist you. These are the most intense pains a human can experience. So you've had a toothache, right? You've probably experienced toothaches that wake you up in the morning or at night. Just multiply these pains by 3. So, multiply the labor pains by 3. Look, yes, I'm not talking about chronic pain. So I'm talking about the pain from newly developed advanced hernia ruptures. These are very severe pains. We're talking about some of the most intense pains a human can experience, but we're not even afraid of these anymore. In patients, we used to be anxious about and would rush to operate on if we haven't detected any loss of strength during our examination. If we haven't shown that there is nerve damage in imaging methods like MRIs, and if our nerve tests still indicate that the nerve is waiting to be rescued under the debris without any damage occurring, we can solve the vast majority of these cases non-surgically, very comfortably, without any fear, and even with the highest success rate. I'm talking about a rate like 93%. So out of 100 patients, 93 of them come in with such a severe condition. For example, you start their treatment that day and they walk out. A patient comes in with such a severe condition, for example, that day you start their treatment and they walk out on their own. They can continue their life as if nothing ever happened. Then you get an MRI 3 months later. What happened to that hernia? What happened to that huge hernia? You see, that huge hernia has disappeared on the MRI. No matter where in the world you receive hernia treatment, you will request your MRIs. So I got treated with you. I'm giving an example from somewhere in America. What happened to my hernia? Where is it? Okay, hernia treatment can eliminate pain, reduce pain, or even result in no pain at all. Because there are 3 paths in front of the hernia. The first one, it goes into hibernation, stays silent. 2 years later, a hernia without sugar on a peak is still in place, but it has given you a 2-year grace period. Am I making sense? The hernia is still the same. At the end of 2 years, it confronts you with a more severe earthquake. Am I making sense? The second option is that the hernia can regress, but it's an uncontrolled regression. You become a chronic hernia patient. Third option is it can progress. The pains become extremely intense. It forces you into treatment. 3 paths. There is no other chance. But most of the time, the pains can somehow stabilize. Human beings do not suffer from pain forever. The body tolerates that pain in some way. Is it clear? So just because the pain simply stops doesn't mean our hernia is treated. We have to show it. I mean, we have MRIs now. Look, we live with technology. We are objective, we are scientists, primarily. We have to announce the results of our work and show them to the patient personally, successful or unsuccessful. So at the end of 3 months, at the end of 6 months, we show the results of our work with MRIs. Like this is how it was. Now, it's hard to show how much the hernia has regressed and how much the nerve has been relieved. By saying it happened like this, you focus on the pain. If you focus on the pain, we can't understand the success rates of the treatment. So you are focusing on the pain. If you focus on the pain, we can't understand the success rates of the treatment. Therefore, it's definitely beneficial for us to show your MRIs. So, in conclusion, it's definitely beneficial for us to show your MRIs